All right, welcome everyone. Thanks so much for being here today. My name is Carly Olson, and I'm the Coalition Manager for the Wisconsin Coalition to End Social Isolation and Loneliness. As you may know, this week is the Wisconsin Social Isolation and Loneliness Awareness Week. And so we are convening partners this week for 2 webinars, and today our focus is on volunteering. We've got some really great presenters here for you today. And I also know that we are here for an hour and a half. So that can be a bit of a long time. You're welcome to take a break, stand up, do what you need to do. I know we're also over the lunch hour, so please definitely eat, drink your coffee if you're like me, you're on your next cup. So definitely do what you need to do to take care of yourself while we're together over the next hour and a half. So if folks are interested and you just jumped on, you're welcome to drop your name and where you're coming from in the chat. And we will jump in here and get started. So I'm going to share my screen. Okay, so can I just get a quick nod that we are all good? Okay, wonderful. So as we jump in here today, like I mentioned, we've got some great presenters here for you to talk about volunteering and social isolation and loneliness, how these things are connected. We will hold all questions until the end. So if you have questions, you're welcome to drop those in the chat, but we will address those at the end of our presentation today. This presentation is recording, so if you or folks aren't able to be here, they will be able to view this later. Okay, so to jump right in, we are the Wisconsin Coalition to End Social Isolation and Loneliness. And just a bit about this coalition if you're new to us. So this coalition is dedicated to ending social isolation and loneliness for people with disabilities and older adults in Wisconsin. And this coalition is relatively new. We got going in late 2020 as a response from the pandemic. And, we've known that this issue has been a big issue in our communities for a long time, but the pandemic gave us a unique opportunity and way to address it and convene partners. So we meet monthly. We have monthly coalition meetings, and then we also have work group meetings, and they focus on policy and advocacy, research and measurement, detection and access to resources, health equity, and raising awareness. Much of the work that has been put together for this Awareness Week has come out of the Raising Awareness work group. So if you're at all interested in joining our coalition, we're always welcoming folks. Definitely reach out to me and I can get you plugged in the way that makes sense for you. So just to kind of get us all rooted in some common definitions as we go through today. So social isolation itself is a objective measure of the number of contacts that people have. So really, this is just being isolated or physically separate from other people. And it may not always be unpleasant, but it can be. So it's sort of interwoven with this concept related to loneliness, which is the subjective feeling. So a lot of us can identify with that feeling of being lonely. And it's really this gap of, your desired level of social contact and what you're actually experiencing. And it really can be quite distressing. And then lastly on there, social connectedness. So this is sort of, if you think of it as sort of an opposite of these things, this is, the ways that we all, connect with each other in the best way that we want that to look for our individual lives. And, it really has a big impact on our health and well-being. So we know a lot about how isolation and loneliness impacts the health and the economy. So I won't go through every single one of these, but here on your screen, you see these, bucketed into different categories. So the first is physical health. So, this issue really impacts some of our chronic diseases like cardiovascular disease or type 2 diabetes. Economic health. So this, looks like lower productivity, more absenteeism from work, a lower quality of work if you experience isolation and loneliness. Mental and behavioral health, this is often one that's very clear for folks. So, if you are feeling lonely, you may also have depression and anxiety or, experience addiction. And then lastly, cognitive health. So those would be things like dementia and Alzheimer's. There are a lot of things that put us at risk for social isolation and loneliness, and I will quickly go through these. Know that you're welcome to have these slides, or again, we're recording this, so you can come back and look at this slide later, but this is something that our measurement and research work group put together to help us understand the different risk factors that, that might put somebody at greater risk for having isolation and loneliness. So going through each one. So individual, this would be things like, maybe you experience depression or anxiety or limited financial resources. Maybe you're an older adult or you have disabilities. So these different things that we individually experience. The next layer is relationships. So, your family supports or your proximity to neighbors, how often you connect with family and friends, the size and the type of connections you have in your social network. The next layer is community. So maybe you live in an area that has high crime or violence, or you have low access to public spaces. These are things that happen in our communities that might put us at risk. And then the last layer is societal. So these are some of those big wicked issues that cross-cut over many different things, but we see them show up in the context of isolation, loneliness, and connectedness as well. So this would be things like, our stigma related to loneliness or disability, or our cultural values of independence and productivity that really, prevent us from being able to connect fully. Or, the different types of isms that we have, ageism or racism. So those are some societal risk factors that exist. So we know that social isolation is really not a personal choice. And sometimes, our own biases can lead us into thinking that, it's a sad thing that happens to someone. And while it is sad, it really is something that's rooted in community design and how we develop and build our communities. So an example of this might be like, if a city decides to build a highway through two neighborhoods that cut off, different transportation systems, something like that, or where we decide to build parks and places where we can gather. I know where I live, there were two neighborhoods many years ago that then a highway was built through them. And previously, different families were in both neighborhoods. So, then it really cut off the ability for them to easily get to each other. So things like this, these are system decisions that we make. So before we transition here into our speakers, I wanted to share this quote with you. And I think it really, roots us in what we're here doing today. So, connection really builds this virtuous cycle. When people feel valued and cared for within a community, they're most likely to contribute and participate in creating healthy and equitable places. So, when we feel connected, we really give back for our communities, and that's what we're here to do. So I mentioned right at the beginning, we're here because it's Social Isolation and Loneliness Awareness Week, and we've got a ton of activities going on. This is just one of them, this webinar you're on right now. We've got another webinar on Thursday, so you're welcome to register for that if you have not yet. And then we've also developed a toolkit of materials that you can use in your work and in your community. So if you did not get that toolkit, definitely reach out and I'm happy to share it with you. So next up, I'm happy to invite our panelists here today. We've got a really great set of folks to talk to you about volunteering and the connection between volunteering and social isolation and loneliness. So without further ado, I'm going to pass it on to Samantha.
Hi, everybody. I'm Sam. I'm the volunteer program coordinator with the Bureau of Aging and Disability Resources. Whoop, and hang on, I'm getting somebody coming home here for lunch. Poor timing, sorry. So today I'm going to be talking about volunteering and its impact on socialization and loneliness. I'm going to be going over some research and things like that. So if there's anything specific that I mentioned that you would love the sources on, I'm happy to share those at a later point. So Carly, if you want to go on to the next slide, please. All right, Carly, if you could click that link, we're going to watch the first minute of this quick video. Hopefully it all works.
Samantha, can you hear the sound?
Nope. If it doesn't work out, it doesn't work out. I guess that's okay.
Carly, I think you might have to end your screen share, and then when you go to screen share the next time, you have to choose the audio option.
Thanks, Tim. All right, let's try this again. How about now?
So one of the greatest things about working for a nonprofit the last 25 years is the fact that I get to work with a lot of great volunteers. In fact, at the food bank, we have 1,000 volunteers that come through our doors each week. One of our volunteers is 84 years old. He likes to come and sort a few canned goods, and then he likes to tell jokes. Most of the jokes he shares are incredibly inappropriate. But he asked me one day, he says, "What does volunteering and wetting your pants have in common?" Well, I nervously shrugged, and he said, "Everybody sees you doing it, but only you get the warm feeling." Not bad for 84, right? But the truth is, there's a whole lot more benefit to volunteering than just the warm feeling. Last year, 64 million Americans donated.
You can probably pause it there and we'll get going.
Time.
Great. So let me change the screen share one more time.
So as he mentioned, there's obviously more to volunteering than the warm fuzzy feeling we get as volunteers ourselves. The video is fantastic, and I'll share it in the chat later for everybody to check out. But it really goes over what we're going to be talking about today in terms of benefits of volunteering. So when we look at volunteering and its impact on individuals, research shows us there's many ways that it improves our lives. And this slide and the next slide, we're going to see just a few that are, we're going to call them the major benefits, but there's more than what we could ever cover today. So volunteering reduces depression, chronic pain, stress, risk of disease, and social isolation. Carly, next slide, please. So volunteering also increases physical fitness, mental functionality, sense of purpose, social connection, and longevity. There's research on top of research about these health benefits for volunteers themselves, but many of them also apply for the people that are receiving services from volunteers. That being said, there's actually a lot less research done on the impact volunteers provide, but I'll kind of cover that a little bit later. So for today, just due to time, we're going to focus on physical and mental health, sense of purpose, and social interaction. So let's get started. Next slide, please. So I'm not going to spend a ton of time going over the health impacts of socialization and loneliness, because that could be a presentation all on its own. And Carly covered it a little bit earlier. So we know social isolation and loneliness have impacts on both our physical and mental health, and it's especially true for older adults. Social isolation and loneliness are associated with higher rates of mortality, depression, and cognitive decline. Research has shown that volunteering can have a positive impact on physical health and mental health. But before I jump into the research, I just want to give a heads up that it's all very intertwined. Better mental health can lead to better physical health and vice versa. So when we say volunteering has a positive impact on one specific aspect of our health, it also kind of sort of creates a chain reaction of improved health. So some of the research is going to seem really interconnected. So we're going to start with from the physical health standpoint. The Mayo Clinic has done some research and found that volunteers report better physical health than non-volunteers. And they stem that from the volunteering keeps people moving and more active. Data from the assets and health dynamics among oldest old study found that volunteers self-reported less decline in health and mobility than non-volunteers. And the same study found a correlation between volunteering and better health and mortality rates, even when controlling for previous health conditions. Several studies have also found that individuals with chronic pain experience declines in pain intensity and levels of disability after they started volunteering. On the mental health side of things, a study out of Detroit called Giving to Others and the Association Between Stress and Mortality found that helping others who don't live with you can act as a buffer against the negative effects of stress. So in the study, participants encountered a variety of stress life events, illness, job loss, financial difficulties. And despite those life events, the people who spent time doing tasks for others were less likely to die than those who hadn't helped others. And those results were consistent against socioeconomic status, education, marital status, age, gender, and ethnicity. And then an Americans Changing Lives survey found that volunteers reported higher levels of happiness, life satisfaction, self-esteem, sense of control over life, physical health, and lower levels of depression than non-volunteers. Next slide, please, Carly. So the next thing we're talking about is sense of purpose. So this quote on the screen, volunteering is one of the best, most certain ways that we can find purpose and meaning in our life. So volunteering can allow you to get to know more about yourself and broaden your view of the world. And per the Mayo Clinic, volunteering, especially in areas the volunteers find meaningful, statistically increases life satisfaction and self-esteem. And the sense of purpose is important because, as a 2004 study found, the social psychological factors and social networks that can develop from volunteering can help protect an individual from isolation and difficult periods of life. Next slide, please. So as I mentioned earlier, there's significantly less research done on the impact volunteers have on others. There's tons of research on the health benefits of volunteering for the volunteers themselves. This quote on the screen, being a volunteer meant being a fellow human being, alleviating loneliness for others and oneself. So that comes from a study that was done on being a volunteer that encountered older adults' loneliness. And I felt it really summed up in a nice, kind of a nice little package, how the impact of volunteerism can go both directions between the volunteer and the individuals that they work with. In the study, they found that both the volunteer and the older adult that they were working with reported their individual loneliness to be alleviated by their encounters. And in a study of 10,000 volunteers, about 2/3 agreed that volunteering had helped them feel less isolated based on increased social interaction and the support system they built based on common interests. Next slide, please. So the question being is, how much volunteering do we have to do to reap the benefits? One study found that the more people volunteered, the happier they were. Compared with people who never volunteered, the odds of being very happy rose 7% among those who volunteer monthly and 12% for people who volunteer every 2 to 4 weeks. Among weekly volunteers, 16% felt very happy, a hike in happiness that these researchers said is comparable to having an income around $100,000 versus $20,000. So that being said, volunteering is just like any other habit we form in our lives. You can't ever make a bigger commitment than you can manage, because one can burn out as a volunteer just as easily as we can in any other aspect of our lives. And to that point, another study found that volunteering consistency is what appears to reap the most benefits, which makes sense. So if you volunteer 1 hour a week for a year versus 52 hours in 1 week, which one is going to have the most benefits? Apologize, the house phone is ringing. 1 second. Sorry about that. Having more interruptions at home than I ever do. Carly, can we have the next slide, please? So the impacts on volunteering in your community. The Points of Light Institute reports that volunteers promote civic engagement and help build safer and stronger neighborhoods, which contributes to happier and healthier communities. And volunteers are more likely to vote than their non-volunteer counterparts. So as I mentioned earlier, many of the benefits of volunteering impact both the volunteers as well as the people that they're helping or providing services for. We can help alleviate social isolation and loneliness in others by simply picking up the phone and calling. As I know, we'll be hearing a little bit more from Christina and Gail in their presentation. So to wrap everything up just into a nice bow as well as I can, there's tons of research that shows the negative health impacts of social isolation and loneliness. And there's tons of research about how volunteering can help alleviate some of those aspects. So as we hear from some of the other speakers today, I want to encourage everybody to think about how you and others can benefit from volunteering and to look into finding an opportunity that allows you to get involved in what's meaningful for you. Thanks.
Wonderful. Thanks so much, Samantha. All right, on to our next speakers. We've got Christina and Gail.
Hi, everybody. How are we doing today? Doing good? Awesome. So welcome, everybody. My name is Christina Felsky, and I am a program manager at Eris Senior Network. Next slide. So I wanted to start off and talk to everybody a little bit about Eris Senior Network's mission. Our mission is to engage and support older adults age 60 plus, adults age 18 plus with disabilities in Waukesha County only, and family caregivers to lead meaningful lives. Our service area is in Milwaukee and Waukesha counties. One thing I really like about our logo, Eris, is that it's an acronym. It stands for engage, relate, advocate, and support. But it also kind of stands for the different eras of our lives. We all go through different eras. And what we do at Eris, we assist older adults age 60 plus to live independently with services provided at no charge. Next slide. So the services that we try to provide at Eris are pretty much access to healthcare, nutrition, and basic needs. So we try to provide volunteer transportation and volunteer grocery shopping and delivery assistance. We also do safety. So we do seasonal yard cleanups, fall and for spring. We just got done doing one actually on Make a Difference Day on the 12th. And something else that we do is our socialization, our friendly phone call program. Carly, next slide. Dun, 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 dun. I don't know about everybody else, but March of 2020 was a transitional time for everyone. We had our pandemic. So what happened at the beginning of March 2020 is here at Eris, we realized we had 1,381 clients that we were servicing. We had to get in touch with them. So we wanted to get in touch with them to decrease the feelings of loneliness and to increase access to food and medication needs. So what we did is we got a bunch of volunteers to start making phone calls. And we made a survey for the volunteers to fill out and complete. They could either call it in or they could email us the results. And we would find out, are the seniors being scammed because of COVID? We're finding out how much medication do they have? Do they have enough food? Do they need to go to the doctor? You know, just because the pandemic happened doesn't mean that medical care could stop. You know, if anything, it increased. So we also wanted to check on them, make sure they're doing all right and, you know, doing everything okay. Next slide. All right, so our friendly phone call program today. Now, we focus on conversations, socialization, and following up on client needs. We have made some intergenerational partnerships with Carroll and Marquette universities. We've reimagined our processes and resources to help better onboard and support volunteers. We also began tracking client outcomes and volunteer impact. Next slide. Awesome. Okay, so just a little, a few statistics. In 2021, We had 255 volunteer callers, and that included 55 Marquette and Carroll University students. We maintained an overall retention of volunteers at a rate matching the national average pre-COVID. I have to stress that one. That's absolutely amazing. We actually wound up getting more volunteers. We didn't decline. We got more because of the pandemic. We were able to serve 796 clients across 2 counties, Milwaukee and Waukesha. And this number is amazing. In 2021, our volunteers placed 18,642 calls to clients in Milwaukee and Waukesha. That is absolutely amazing. And now we're also continuing to work with the university partners. Right now, we are currently hosting a cohort. Once I learn how to talk, we're hosting a cohort with 20 Marquette and Carroll College University students. Next slide. And I wanted to share a couple quotes. These have come directly from our clients, and I think they have a lot of meaning to them. So the first one, I so much appreciate getting the call from my very favorite person. Gives me a feeling of security. Someone else said, I enjoy talking with someone that lives in the town I grew up in. I have so many things to share. Another client said, Air's friendly phone call program has been a great support for me. Could not have been independent as I am without support. Another client said, it certainly helps when you know that someone cares about you, especially when you are alone and lonely. And everybody has felt alone and lonely before. And last but not least, this program helped me get through my cancer treatment in so many ways. Amazing. This program is so essential. My phone person is amazing. They are pretty amazing. Next slide, Carly. All right. So shameless plug. Here's your opportunity. If anybody's interested in the program, volunteering, or finding more about the programs that we run at ARIS, our website is aris.org. But then you can also reach out to Milwaukee County Mainline or Waukesha County Mainline for more answers if you have any questions. Next slide. All right, here we go. So the meet and greet with Miss Gail Morley. And I just want to introduce Gail real quick. Gail is a self-proclaimed Army brat who received her education in various parts of the world like Japan, Germany, and Arizona. She used her education to fuel her career as a community mental health counselor. She's also volunteered in many different fashions in her adult life. Gail was a big sister. She's fed people in soup kitchens, visited residents in nursing homes, and served as a senior ambassador, where she helped seniors assess their needs and connect to resources. And that's what led her here to ARIS Senior Network. So hi, Gail. Thanks for coming. We're so happy to have you.
Hi, Christina.
Hi, how are you?
I'm very good, thank you. How are you?
I'm well, thank you. Well, thank you so much for joining us today, Miss Gail. And so we'll jump right into it because we really love to hear what you feel about volunteering. So Gail, can you tell us a little bit about your current volunteer experience with ARIS Senior Network?
Okay, well, in late March of 2020, I signed up to become a friendly phone call volunteer. And I got a list of 7 names. As it happens, all women, mostly in their 70s and 80s, and all living alone. And so I called all 7 of those women. 2 said no thanks immediately because they had plenty of support, they felt. 3 of them, I'm sorry, 2 more said in the next couple of months, thanks, but I do have plenty of support, so I don't really need this program. 1 lasted almost 5 months, one of those ladies. And then one, or the final 3 on that list of 7 wanted to participate in the program and agreed and wanted weekly phone calls. I gave them the choice of weekly, every other week, monthly, or even more often or less often. And those 3 all chose weekly. After almost a year of speaking with one lady, she had a stroke and then she needed 24-hour home care. and she was just unable to continue with the program. I miss her dearly, but that happened, as I said, about a year after the program started. And then another lady who happened to be blind, she nursed her husband until his death about 20 years ago, and then continued to live alone. She passed away in July of this year after almost 2.5 years of the two of us speaking weekly. I still miss her. And my final number 7 lady, I still call every Friday afternoon from March of 2020 until now. I will be speaking to her this Friday. She's 89 years old, she's funny, and she's brilliant. And I always look forward to my Friday calls. So we just talk about whatever. We talk about the fact that I'm an Army brat. They're always interested in that. And the fact that I am an Army brat meant that I was constantly changing towns, changing schools, changing locations. So I don't have any connection to anywhere in the world, really, for a long, long term. And I certainly don't still know any of my childhood friends. So that's something really important I get from this program is most of these ladies that I've talked to were raised in the Milwaukee area or have lived here most of their lives. And so they really feel connected to this community. They're able to share a lot of information about the Milwaukee area with me. And they've become friends. So
I love it. I love it.
Phone caller.
Okay. So why did you choose to volunteer in such a capacity?
Oh, I've done, as you mentioned, Christina, I've done lots of different volunteer kinds of activities. And when the pandemic started, I felt isolated. I stopped going in person to stores and lots of other places because of the mask wearing policies. And I mean, I did wear masks when I went out, but everybody was staying home. Everybody was fearful. And I immediately felt lonely because I live alone too. And I'm now 74. So when I started this program, I was 71. Anyway, so I really just love to talk with other people and hear their stories and share my story. And this has really been a mutually beneficial program for me.
Love it. Well, my next question, what has volunteering done for you personally? But I think you got that one. But is there anything else you'd like to mention about what volunteering's done for you?
Just that it's a way for me to connect with others and to feel useful.
Great. And my very, very last question, what would you tell others watching about volunteering and its impacts?
I think that volunteering is a way to give back to the community, to the world, and that no matter what hardships I may be experiencing, it's a way to get outside of myself and to do something useful, fun, interesting. It keeps me growing and learning. It keeps me alive.
Well, you know what? That is very sweet, Miss Gail. I thank you so much for sharing your experiences, and I thank you for being a good person. Thank you for sharing yourself with others, and thank you for changing the world. We appreciate you.
Thank
All
you.
right. You're welcome. Back to you, Miss Carly.
Wonderful. Thank you so much, Christina and Gail. It's great to hear from you both. All right, so next up here, and I'm just going to change a few settings. Next up, we've got Margie and Diana. So over to you both.
Hi, everybody. I'm so glad you could join us today. Just a bit. So the first slide shows our mission, and it's to make a positive impact in the community by recruiting volunteers 55 and older to help deliver priority services to people of all ages, providing Dane County with a valuable resource. And we have been carrying on this mission for 50 years this year. So we were the first RSVP in Wisconsin, and we're actually one of the largest in the United States. Next slide. So our program is part of the Corporation for National and Community Service, the AmeriCorps Seniors Program, and our particular program has both an RSVP, Retired and Senior Volunteer Program, and a Foster Grandparent Program, FGP. And we would love to someday also have a Senior Companion Program. But our program has it has a twofold purpose, and we recruit volunteers to help others in the community. But as we've been saying all along in these presentations today, there is a big benefit for those who serve. And that's been proven through many different surveys and testimonials from people. Next slide, please. So we're on a topic today about volunteering does help decrease social isolation. And there was a 2018 survey from the Corporation for National and Community Service reported that 78% of the volunteers feel less depressed, and 84% reported they had improved health. One of our volunteers has said, "I feel that I help provide a much needed service. It gives me a reason to get moving each day, connect with people, and gives me the feeling that I am contributing to society." So with the next several slides, we'll be talking about different parts of our program. And although this might not be available in your community today, you could think about ways that you could incorporate some of these projects in what you would like to do. There are 15 RSVPs in Wisconsin and 10 foster grandparent programs and 2 senior companion programs. And you can always contact me. I can put it from, well, I think you have the information already. We can connect you up with perhaps an RSVP, a foster grandparent or senior companion program in your community. Next slide, please. So as RSVP has been working on this for 50 years. I mean, we have personalized placement opportunities. So our staff helps a potential volunteer find what they would really like to do in the community, something that's meaningful to them. We'll ask about the interest, skills, and location, age group that person might like to help. But I think that's so important because we know not all agencies offer that. And we want to connect people who have maybe trouble finding what they would like to do or not knowing where to go in their community. And it's more than just looking up opportunities on your computer. We will help you find the right match for you. And we have so many volunteers we honor each year that have served 20 years or more. In fact, with our driver services program, our longest serving volunteer has delivered meals for 43 years. And that's a real testament to the fact that if it's a good match for what somebody wants to do, they will feel fulfilled and want to continue. Next slide, please. So in a nutshell, these are our services, and we'll talk about them individually in each of the upcoming slides. Next slide, please. So we got started by tapping on doors and asking if a nonprofit or public agency would like help. Would they like an older adult to help them fulfill their mission and extend their services? And today we work with over 70 nonprofit and public agencies. So as I described before, this personalized placement is so key. Somebody can tell us what they might like to do, but what are the different options? And they might have choices, and pre-pandemic, we were taking people to the volunteer station, and that's what we call where they're going to serve, and going over the possibilities, and then they could decide. And then our staff then is also available. Maybe this opportunity isn't going to work well, or maybe they try it for a while and they want to do something different in the future, but we help them find a good assignment. Next slide, please. So one of our longer standing programs is our Driver Services Vets Helping Vets program. And early on in our program, the county actually asked us if we could help with transportation, which everybody knows is still a huge need in everywhere. But we have volunteer drivers who help people to medical appointments. And then we also have volunteer drivers delivering meals and helping with our newer part is delivering groceries to folks that need it. And then 12 years ago, we added Vets Helping Vets, where we have volunteer drivers who are veterans themselves, helping other veterans who need a ride to a medical appointment and other types of appointments. Next slide, please. Diana will tell you about the Bus Buddy program.
So about 10 years ago, we added a new program. Dane County asked us to add this new program as a way to help teach individuals how to navigate around Madison on the Madison Metro bus, a way for them to be more independent, go places they want to go without relying maybe on family, friends, or group transportation. They worked one-on-one with Bus Buddy, volunteer Bus Buddy coordinators, and learned to go different places around the Madison area. A couple years after that, we added what was called the Bus Buddy Tour program. And that involves groups of people, groups of participants working with Bus Buddy coordinators to go to different locations. Not only were they learning to navigate around the bus or navigate the bus around Madison, but also they participated in group activities, which facilitated friendships, sort of a support network, and gave a sense of community. We are in our 10th year of doing this now, and COVID did slow us down a bit, but we started up again this year and had 5 programs, 5 tours that we took people on, where people got to go places, have lunch, make friendships, and learn how to get around.
Next slide, please.
And then the intergenerational program. Intergenerational is primarily volunteers that work with students in Dane County schools one-on-one, in small groups, doing personal projects or classroom assistance. But as you can imagine, during COVID, this came to a screeching halt, and our virtual programming, the Computer Buddy program, as well as a couple of new programs, really took on new meaning and was a way for our volunteers to be able to communicate and work with students, keep in touch while not actually being in the classroom. The Computer Buddy system is an online blogging system. We're in 3 different school districts, and we have about 90+ volunteers that do this program, and they blog once a week with students. And by the end of the year, it starts out as a real kind of get to know you blog, and by the end of the year, they become very close friends. And we have a Computer Buddy picnic or party that they get to meet their buddies with at the end of the season. And you can kind of see the picture there of one of our Computer Buddy volunteers with her 2 buddies. We also started a new program with the foster grandparent program about 20 some odd years ago. And this program is for low income seniors who receive a stipend, a tax-free stipend, meal, and some transportation reimbursement, working one-on-one with students with extraordinary and special needs in the Dane County schools and Reach Dane Head Starts. And like intergenerational, this program, again, it was very hard for our volunteers to participate during COVID. And we started some virtual opportunities for them. The Computer Buddy program was one that they could participate in, but we also started a new program, which was called the Postcard Pen Pal program, where our volunteers worked with 5 kindergarten classrooms in Chavez Elementary, a local Madison elementary school. And this program was wonderful because, again, it gave a sense of communication, a way for our older adult volunteers to still work with students. And especially some of our older volunteers that maybe weren't tech savvy. This was an old-fashioned postcard writing program. So it promoted literacy and handwriting while giving the student and the volunteer somebody to communicate with and talk with and be in touch with throughout that time. And then the last program we've started just in June is another way for our volunteers to be able to communicate if they cannot go into the classroom. And we worked with Dane County Area Agency on Aging for a Claris Companion. The Claris Companion is a tablet that makes virtual opportunities a little bit more accessible to all. So they'll be able to communicate with their friends, their families, work online with students, and participate in different kinds of webinars.
Next slide, please. One of our longest standing programs is Group Projects Home Workers, and a program that actually grew during the pandemic. We currently have 250 volunteers making handmade items for people in need. And last year they donated over 15,000 items, hats, mitts, mittens, scarves, quilts, you name it. People get a lot of joy out of doing this. And really this program allows volunteers to continue to serve as they age, because you can do it as a group, but you can do it at home too. In fact, this year we had a volunteer who signed up 2 weeks before her 102nd birthday. And then recently, a couple of years ago, we had a volunteer who passed away at 107, but she continued to volunteer until she was 105. And she got a volunteer award for serving 20 years at that point. But it's a way for them for volunteers to make, continue to use their skills and their interests to make things that they like to make. And we have lots of different projects that they can work on. Next slide, please. We're part of the Triad program, and this is a statewide group. And we have local Triad programs that have gone all online during the pandemic, but the older adults and those who work with older adults can learn how to avoid becoming victims of scams and frauds. And then there's a statewide conference that's available to anybody to attend. So it's a great way for people to advocate for each other and find out information and stay connected that way. Next slide, please. We're always hoping to recruit additional new volunteers. And, we do surveys all the time. And I just want to report that the survey that we did last year, 95% of our volunteers who responded to this survey agreed that their volunteer experience gives them closer ties to people and their community. So that's a really high percentage. We also survey our passengers, and the survey that we conducted this year, 58% of the passengers who responded said they feel less alone. Oftentimes we've heard that the volunteer driver who is either helping them to a medical appointment or delivering meals can be the only person that this client sees on a daily basis or for that day. And one of the passengers reported recently that she almost likes going to her medical appointments because the volunteer driver is so helpful and so nice to talk to. We've covered everything, and we'll have room for questions later, time for questions. Thank you.
Great. Thank you so much, Margie and Diana. Okay, so last but definitely not least, we've got Deanna here with us from United Way. So Deanna, over to you.
Wonderful. Thanks so much, Carly. Just want to check in on my audio. Is it coming through okay?
Yep, you're good to go.
Sounds good. Thanks so much. So yes, grateful to be a bookend to the conversation today that has really highlighted really on both sides about what connection looks like, and through volunteerism, how the connection both for those who are perhaps receiving the quote unquote benefits of the services or programs, it's really a mutual exchange. So I'm here today to share more about how 211, United Ways, and Volunteer Wisconsin can serve as channels of connection for volunteer opportunities that are available in communities. Next slide, please. Next slide on this as well. Thanks so much. So the mission from a 211 United Way perspective is really to harness the caring power that exists in community. And specifically, we focus on conditions around education, financial stability, and health, which we really see as the building blocks of a good life. Next slide, please. United Ways and 211 work to serve as trusted community partners and really exploring with community members what the intersections of social care, healthcare, and government services look like, and how those can best be connected to serve members of the community and addressing those social determinants of health. From a 211 perspective, we are available 24/7 and accessed by millions nationally each year. We have connection with national, state, and community partners within the social determinants of health sphere, and a database that has more than 30,000 services. Our 211 staff members, who are actually located here in the state of Wisconsin, are highly trained and follow national standards, both to answer the questions that people initially present with when calling 211, but also committing additional thought and consideration about what some of the underlying circumstances are for callers, to really explore what in their communities could best help and support them. We foster and maintain robust partner networks with a national network that is hyperlocal. Next slide, please. We partner with, and really this just represents community, people who need help, people who give help, and the systems interested in the community condition. Very early on in the presentation, Carly mentioned that social isolation is not a personal choice or individual problem, but really one that is rooted in community design and social norms and systemic injustices. So really, communities are in the best position to be asking the good and hard questions about when individuals identify that they feel separate from community or are looking for connections, how as communities together can we come together to really ensure that the space is inclusive for everyone. We also recognize that in the community, at any given time, that help does not always need to be requested, and that it can be offered proactively to ensure more equitable access. And we work with public and private partners to co-create solutions, ensuring everyone has the resources, support, opportunities, and networks they need to thrive. Next slide, please. And I'll speak first about 211 Wisconsin. Next slide. I did not include this one, but from a national perspective, if you are anywhere in the United States, 96% of the geographic area of the US is actually supported by 211. In Wisconsin, we have 100% coverage thanks to our 8 regional contact centers that you see highlighted in the various colors in the various parts of the state here. So our regional contact centers are really the best positioned to develop and maintain the connections with local community partners who are providing the services and resources to community members. And again, mentioning that we are available 24/7, 365. Next slide, please. So 211, I wasn't entirely sure who the audience might include today, so perhaps this is already very familiar to you, but wanted to name that from a 211 perspective, we really hope that we can support questions that run the gamut of, I'm looking for affordable dental care, or I don't know how I'm going to pay my medical bills. I know in the presentation before it was around transportation services. It might be a food safety question. It really runs the gamut that 211 can be a first stop for people with a 3-digit dialing code to call and speak to a real person in real time about the questions or concerns they're looking to have answered. Next slide, please. So this 3-digit dialing code, like a 411 or a 911, when you dial 211, we really see 3 primary points of connection that we can make for the callers who call in, which might be someone who's looking to identify local community services. This might be in times of disaster, so perhaps flooding, or there's been a tornado, or other things that are happening in any part of our state, that it can serve local communities as a first point of access to understand what resources are available or will become available in times of disaster. And then really for today's conversation, 211 is also a place that if you are someone who's looking to help others, you can also dial 211 to understand what local volunteering opportunities exist in your community. Next slide, please. Secondly, I'll speak to United Ways in Wisconsin. Next slide. So what does United Way do? United Ways are a place in community, again, focusing on health, education, and financial stability to be in service, bringing people, organizations, and resources together. So really to walk alongside communities and understanding what do the needs here look like and what services, programs, resources are available, addressing those needs, and how is that going, and perhaps what other resources within the community or outside of the community might we need to bring in to ensure that the needs of our community members are thought of in the ways that are genuine to our community members, and supporting communities to be working alongside one another to help address those. Next slide, please. So I don't know if I mentioned this in the beginning, but I am with the 211 United Way of Wisconsin office. So again, I'm connected to the 8 regional contact centers and then the 40 local United Ways throughout the state. So we are actually a point of connection that if you are in a local community with questions or looking to make outreach with a 211 or local United Way, we can help you get in touch. So we are the statewide organization that provides member support services to the local and independent local United Ways in Wisconsin. So each of these 40 local United Ways across the state are governed by a board of local volunteers who then work with their local partners to determine the needs, setting priorities, and making local investment decisions. Next slide, please. So thirdly, and I will go back to ensure that the chat includes links to 211 and to find your local United Way. And then thirdly, I'm going to be speaking to Volunteer Wisconsin. So Volunteer Wisconsin is a statewide resource, a statewide online resource, where whether it's from an agency perspective, you are looking to share services and programs that you are looking to be supported by volunteers, or if you are a volunteer looking for volunteer opportunities in your local community, Volunteer Wisconsin is a place that you can go to find that information or to share that information. Next slide, please. Volunteer Wisconsin, it is an online statewide volunteer system, and we manage Volunteer Wisconsin in partnership with Serve Wisconsin, which I know was also mentioned in the previous presentation, which is Wisconsin's National and Community Service Board. So again, volunteers can search for opportunities near them as well as organizations advertising those opportunities. Next slide, please. So we are hosted, and this is maybe an unimportant detail, but it's the actual platform is through Galaxy Digital, and this is a volunteer data managing tool. So in addition to opportunities information posted directly to volunteerwisconsin.org, we also are doing what we can to be partnering with the volunteer centers that already exist in every region to ensure what is being captured information-wise about opportunities through volunteer centers can be also represented here with Volunteer Wisconsin. Next slide. Here are a few visuals. I don't know how readable these are in the size that they are, but just wanted to give you a little taste of when you go to volunteerwisconsin.org, what is it that I see and how does that look? So you can kind of view it from a just seeing opportunities by title and where it is that they're located. You also, though, can select a filter. So perhaps I am a particular age looking for a particular volunteer opportunity for my age demographic. Or perhaps, and I know that we've touched on this a couple of times, the pandemic really pushed us as communities to think about how do we, again, harness and sustain the caring power that exists in our communities with the needs that exist. And virtual options were really what a lot of organizations had to pivot to. So I might be a volunteer that is only able to offer my support through virtual opportunities. So volunteerwisconsin.org allows you to select filters to really hone in on a volunteer opportunity that best aligns with you or those who you'd be volunteering with. Another sorting feature allows you to choose alphabetically, those that are available from a calendar perspective. I'm really looking for something as soon as possible, or I'm looking for postings that are ongoing and have been around for a long time, or maybe I'm interested to see what volunteer opportunities are more recent and new. So here's just a few visual examples of ways that you can sort information on volunteerwisconsin.org. Next slide, please. All right, and then this is just going to be some details on how to get connected. So next slide. And I will pop these in the chat as well. Just naming that from a 211 database perspective, we rely on our regional contact centers and our local United Ways. We also rely on agency partners across the state to share with 211 what are the services and programs that you offer where you're also requesting volunteer support. So ensuring that your agency services are listed in the 211 database. You can reach out to our office and then we will get you connected to your local regional contact center, or finding your local 211 regional contact center and touching base with them and ensuring that we have represented the service that you provide. Next slide, please. So from a 211 perspective, from a 3-digit dialing code, of course, 211, there are times when from a mobile phone, 211 is not always responsive. So to ensure that you are getting connected to a Wisconsin-based regional contact center, you also have the option to use this 10-digit dialing code. We also have a texting feature that will then just request your zip code to ensure that we're honing on the services and resources in closest proximity to you. We also have a live chat and we are searchable, services are searchable on our website at 211wisconsin.org. From a local United Way perspective, I do have a link that'll allow you to scroll through identifying which local United Way or local United Ways are in your closest region, or perhaps you're going somewhere else in the state and you'd like to make that connection to volunteer there. So I will provide that in the chat too. Our office phone number is here as well as our office email. And in a couple of slides, I've also put my personal email, which you're welcome to drop a line and I'd happily get you connected to where you're looking to be. So next slide. And then lastly here is the volunteerwisconsin.org website, and just sharing again with the group today that this can both be signing up as an individual if you are seeking volunteer opportunities, or as an agency if you have opportunities you're looking to engage volunteers with. And this will be required on both sides, building a profile of either yourself as an individual or as an agency, and then identifying volunteer opportunities you're interested in or volunteer opportunities that you offer. Next slide. And then just lastly, just appreciation. It's been really heartwarming on a day that, like a snowy cold day, it's just really lovely to be in conversation with people, sharing about the different things that are happening in community and especially in connection with others. If you have questions or thoughts you want to share from a 211 or United Way perspective, please reach out to me. If I'm not the best person to answer or respond to that, I will certainly think about who might be. So this is my email and would welcome your contact. And I think that closes out the information I was going to share, Carly. Thank you.
Wonderful. Thank you so much. Okay, so I think a couple of questions did come through in the chat. So if you do have questions for any of our presenters, you're welcome to drop those into the chat. But I wanted to address the ones that were put in there first. And I've got Tim and Chris also helping me grab all of the questions. So if I miss something, definitely please jump in. So I believe this question was for Christina, and the participant is wondering if you're still having the Friendly Call program.
Yes, indeed. It is an active program. What would have to happen so we got the two sides, right? If you want to volunteer, you could reach out to either one of our lines. I can hand out that information as well, to start the application process to become a volunteer. Or if you want to be a client, you'd give us a call at our main line and we'd start the process to assess you to become a client. And yeah, we have other services as well as friendly phone calls, but you can definitely become a client just to receive friendly phone calls.
Great. And I believe this question is also for you, Christina, from Jason. Did you assign a specific volunteer to a person?
Well, okay, so we try to match as well as we can with volunteers and clients. So they stick with the same person, but sometimes it can be kind of difficult to go into, differences like religion and, politics, all the different, likes and dislikes that people have. But they do stay consistent. But if there were ever any issues or concerns, we could always rearrange things. But yeah, we do assign them. Some people have a caseload of one person they call per week. Some have 15. So it's pretty much whatever you want to do.
Great, thank you. And then I see Joan in the chat was mentioning the need to create a list of resources in Wisconsin. And I am not sure if this question is for a specific person, Joan. So feel free to drop a comment in the chat if you have more to add, but just a note on that, one of our work groups, the Access and Detection work group, has been doing a lot of work around resource collection in Wisconsin. And so, definitely that is in progress. And as many of you know, resources constantly shift and change. And so we're doing our best to keep up with that. And then the last thing I'll mention about that is there are an additional cohort of staff that have joined the Bureau of Aging and Disability Resources as resource staff. And so they are also working on resource collection. So they're very new, but hopefully soon more will come from them. I've got another question from Joan in the chat about if you can share surveys. And I think that question was for you, Margie and Diana.
What would be the best way to do that, Harley?
Sure. Yeah, Joan, if you want to just, you can either email me your email or drop your email in the chat if you want, then we can get you two connected. Great. Awesome, Margie. Joan dropped their email in the chat for you.
Okay, thank you.
Great.
Harley, Ramsey Lee has a hand up.
Great. Yeah, go ahead, Ramsey.
First of all, thanks for the hard work that this conversation does. The gal that was speaking from United Way, can I have your contact information or that contact information? Because that sounds like a real good resource. Thank you for the work you do, and I would love to help you guys out. Thank you.
Thank you so much, Ramsey. Yeah, I can definitely get the United Way information over to you. Wonderful. Any other questions from the audience?
Carly, I forgot the name of the gal that was speaking from the United Way, but that'd be a great connection. And then the other thing is, how do I start a friendly phone call program in my community of Hudson?
Yeah, thanks, Ramsey. I saw Chris, you come off of mute. Did you have something to add?
Yeah, I think that's a great question, and maybe Christina and Margie can talk about this. How to, what would your advice be to get a friendly caller program started? Like, what would be the pieces you need, the funding you need? It sounds like there's like perhaps background checking and other things that have to happen. So maybe speak to that.
Well, I'll get started. So you're gonna need clients. You're gonna need people to talk to. You're gonna need background checked volunteers that are willing to speak with them. You have to come up with a routine for, what days, what times, what information are you giving out, what are you going to be talking about. Also, another good thing for friendly phone call programs is like guidelines. We try to stay away from politics and religion as much as possible. I mean, we don't ban it. If you want to talk about it, go ahead. But we have other things that we can talk about too. We have hobbies, we have current events, we have things like that. So those are the good components to a friendly phone call program on my end. What about Margie?
Well, we used to recruit volunteers for another agency in town that had a telephone reassurance program and was also a safety check. And that organization is no longer doing that. And as a matter of fact, is not in existence anymore. But at one time we were approached whether we would consider doing that. And we looked at, the staffing problems in that you have to have, if you're going to do telephone reassurance as a safety check, then you need to have someone available 7 days a week to be a backup to if a volunteer can't reach the client, what happens next. So that's a stumbling block our program wasn't able to address. So it's something to keep in mind. Is it going to be a friendly phone call, or is it also going to be a safety check? And you are right, Carly, to mention the background check. We have assignments that we do require background checking. If the volunteer is going to be working with a vulnerable population, seniors or children, then we do require background checking. So
Great. Thank you, Margie and Christina.
and this is not a related to this particular issue, but I want to say that the pandemic changed so much for our organization. But one good thing that happened was using Zoom, and our organization latched on to that right away. And when we were able to have a combination of meetings via both Zoom and in person, we did that, and we still carry that through, and it makes us more accessible. So it's a great service, or there are others like that too.
Thanks, Margie. Yeah, I think you're highlighting sort of in this transitionary time in the pandemic about how, we perhaps get the benefit of both virtual spaces and in-person spaces. And, I think that virtual component is, with us probably for a long time, if not forever. So having all of those different types of accessibilities makes sense. Wonderful. Well, I don't see any additional questions in the chat. Know that we're here if you want to reach out. I just see a couple more questions here. Yeah, go ahead, Chris.
Oh, I was just going to point to those two. Go ahead.
Oh, sure. So Diane, yes, the webinar will be available for future viewing. We are recording, and we will get that recording processed and uploaded and then share that back out. And then Tom's wondering if anyone has organized a friendly Zoom program, sort of like a call, but on Zoom.
Well, we do a couple things. We have a monthly Zoom event where we invite all our volunteers to join us on a call. It's always a different program, and we have some, we order books as a giveaway for the first 5 people that are chosen. So, or it could be, it's related to the topic. And so those are a lot of fun and interesting, and we've covered a variety of different topics over the past 2 years. And then what were you going to suggest, Diana? Was there something else?
No, just our Zoom event.
Yeah, our Zoom events, but also, well, the foster grandparents have a movie club and a book group, and those are done via Zoom too.
And literacy videos.
And right, the literacy videos.
Great, thank you both. Ramsey, did you have another question?
Yep. I was just gonna add that People First Wisconsin has weekly Zoom events on Monday and Thursday. If anybody knows of anybody with a disability, People First Wisconsin has Zoom events on Monday and Thursday. Monday at 4:30 to 5:30 and Thursday from 6 to 7. So that's another good way for people to get information. They also have a speaker series every Tuesday from 11 to noon, and that's all on Zoom. So People First Wisconsin has wonderful things. So that might be a good resource for anybody that's looking. Thanks.
Yeah. Thank you, Ramsey. Yeah, so just sort of the offer out there that if you know folks in the disability community that might want to participate in a space, Ramsey would be a person to definitely connect to. Ramsey, if you don't mind maybe dropping your email in the chat, that might be helpful for folks if they want to refer people, and then maybe you could help them get connected.
Yeah, actually, Kylie, I think you have my email, and I was going to refer them to the People First Wisconsin website, which is peoplefirstwisconsin.org, and then they, under the events tab, they have all their Zoom meetings. Yeah.
Awesome. Yeah, it looks like Chris grabbed that link for you all, so you should be able to see the different events that are going on. So thank you both so much. Awesome. Well, thank you all so much for your time today. Thank you to our speakers. I'm really glad that we were able to convene around this topic in Wisconsin. As mentioned at the beginning of our time today, we do have another webinar on Thursday focused on innovation and initiatives going on in Wisconsin. This will be very discussion based, so it'll be less presentation and more time together in breakouts. So if you're interested in learning about what folks are up to in other parts of the state, definitely register for that webinar. And the presentation part of that webinar will also be recorded. And then of course, always an open invitation to join our coalition. If you're interested, definitely reach out and we can get you connected into the right place. So thank you all so much. I hope you have a great week. For those who have snow, hopefully you are excited about that. And if not, you're cozy inside and can look at it outside. So this is about the time of year where it looks pretty and we can enjoy it a little bit. So thank you all so much, and we will see you soon.